I am Dr. Mark Stickney, and welcome to Ask the Vet Live. It is great to have everybody here today. As you can see, we are doing this at a different time than we have in the past, and we'll see how that works out for everybody. I am so glad that you are here today, and over the next 30 minutes, we are going to talk about things that are happening in the world of pets and at Spay Neuter Network. And we will take any questions that y'all send in to me live while we are here. I also have some questions that we can go through that have been emailed to me ahead of time. So, with that, let me start off by saying a great big thank you to everyone who donated for North Texas Gives to Animals. You were extremely generous, and we are extremely grateful for your support. All of that goes directly back into our ability to help spay and neuter and provide wellness care for as many animals as possible. So, thank you very much for that. I would also like to mention just quickly that it is Adopt a Cat Month. So if you have been thinking about a new pet and thinking about a cat, now is a great time to do it. And we here at Spay Neuter Network will be more than happy to help you get that pet up to date on vaccines and any kind of flea control, heartworm preventative, and spaying and neutering them. So if you are in the market for a new cat, it is Adopt a Cat Month, so it's a great time to do that. Let's go ahead and jump into some questions that have come in. So, Jason has written in to say, my dog has heartworms. Is fast kill or slow kill treatment better? The veterinarian seems to suggest the fast kill. My worry is the risks and complications of the fast kill method, especially since he is a Malinois. I have read it is important that the dog does not get a lot of exercise or get very excited for the couple of months the fast kill method takes to work. All right, that is an excellent question, and that is a question that comes up with everybody who has a dog that has heartworm disease and needs to be treated. So basically, the difference between the fast kill method and the slow kill method is that the fast kill method is used to rapidly kill the heartworms, and by doing that, your pet no longer has worms that are growing in its heart and in its pulmonary artery, making it more difficult for blood to flow and blood to oxygenate and causing swelling and inflammation in the heart and in the lungs. So that gets it done more quickly, and the sooner those worms are dead, the better. The slow kill method is a method that is really not recommended much anymore. It is something to do if you cannot do the fast kill method for some reason, but basically you will put those animals on heartworm preventative, and over the course of the next couple of years, the slow doses of the ivermectin or whatever the agent is in the heartworm medicine will slowly kill those worms. The downside to that is during that time, those worms are continuing to live there and cause changes in the heart and in the lungs for 2 extra years than it would be if you did the fast kill in the first place. So, with the fast kill method, there is an injection that is given once, and then a month later they receive 2 injections over the course of 2 days. And during that time of those 2 months, your pet must be exercise restricted. And the reason for that is because the worms are rapidly dying and they're breaking down and falling apart, and we don't want the dog to be active and have those little pieces of worm create things like a blockage in a blood vessel or in the lungs and cause a problem there. So that being said, the fast kill method is definitely the way to go, if as long as there is not any underlying reason not to do that. The fast kill method is definitely the preferred way to go. Now, you have a Belgian Malinois, and we have to keep them calm. And every dog is a struggle to keep them calm for 2 months and have them kennel restricted. But it is very important, And if we look over the course of your pet's life, 2 months is really a drop in the bucket compared to all the years they're going to live with you. So during those 2 months of time, we need to have them in a crate that is big enough for them to stand up and turn around, but not any bigger than that. They're going to go outside to on a leash to do their business, and they're going to go back into the crate. Now, the great thing is that we have some really good sedatives that work now that will help to keep your dog calm and relaxed during that time. And then you can also give them enrichment things like toys, rawhide chews, things like that as well to keep them busy there. So it won't be the easiest 2 months, but you'll be able to get through it. Talk with your veterinarian about sedatives for your dog, and think of ways that you're going to keep your dog occupied while it's in that crate, and that should all go just fine. Okay, Emily writes in to say, my cat was spayed a week ago. The incision looks good to me, but she has a lump where the surgery site is. I'm monitoring it to make sure it isn't getting bigger, but just want to know if this could be normal. She is eating, drinking, using the litter box all fine, and she is acting normal. She is quite active and probably tried to do too much too soon after her surgery, honestly. The lump is oval shaped along the whole incision and just around that area. She is terrible to get in a cat carrier, and I'd be afraid of hurting her further if I can avoid going back to the vet. Well, first off, Emily, that was a great description of what is going on with your cat. That really helps me a lot. And you have hit on some of the most important things for whether or not your cat needs to get rechecked, and that is that they are acting normally, they're eating and drinking normally, they are using the litter box normally. So those are all good things. That's exactly what we want to see. The incision, you are monitoring it frequently. It is clean and dry and non-painful. Those are all things that you want to check for, but there is a firm swelling there. So the good news is that this is a perfectly normal thing to have happen in a cat. And what this is a suture reaction, is what that is called, a suture reaction. And cats, as a species, have very reactive subcutaneous tissue. Your subcutaneous tissue is the squishy fat stuff that's underneath your skin that lets your skin slide around a little bit. So in cats, their body doesn't like when anything that doesn't belong gets in there. And as a result, it brings in white blood cells to attack whatever that is and break it down. So, what you are seeing is your cat's normal reaction to the suture that is there from the surgery and breaking it down. And that is a perfectly normal and a very, very common thing to see in cats. So it will probably take that about 2 weeks to completely go away. But once it does, then things will heal up and you will not be able to tell that hardly anything happened there. So, this is an excellent question. Very, very well posed. And I think that you do not have to try to get your cat back into the carrier. It sounds like everything is going fine. And this is something I would expect after surgery. And the timing a week after surgery is right on track for this. So, that is good. Okay. Sam writes in to say, how do I know if my cat has rabies? My cat sometimes unintentionally scratches me. It would be better to know more about rabies and the recognition of symptoms and how an infected cat behaves. However, I've vaccinated him, but he is engaged with stray cats. That's why I'm asking. This is a great question. So, rabies is a major public health concern. In the year 2022, which is the last year that we have data for, there were 3,700 dogs and cats that tested positive for rabies in the United States of America. And every year there will be between 0 and 3 people generally that get rabies, and it's going to be from an animal bite. So, rabies is an important thing to know about. You're doing exactly what you should be by having your cat vaccinated for rabies. The rabies vaccine is possibly one of the best vaccines that has ever been created at preventing an animal from getting the rabies virus. So, rabies is spread through the saliva directly into the blood or mucous membranes. So, an animal has to be bitten by an infected animal to get rabies. If your cat was an indoor only cat, you wouldn't need to worry at all. Because your cat is around other cats, that increases the risk of them getting bit by an animal that has rabies. Maybe a cat, maybe a raccoon, maybe a bat. So those are all possibilities, but you vaccinated your cat, so you should be in good shape. One of the first things that you would see is that your pet had been bitten, had a bite on it. And if you saw that, you would want to contact your veterinarian, not only to make sure if that the bite needed to be treated or not, but also to make sure your pet was up to date on its rabies vaccine. And depending on whether or not you knew what the bite was from, your veterinarian may recommend a booster rabies vaccine at that point. So once an animal is bitten by another animal with rabies, that virus goes underneath their skin and it gets into the nerves. And from there, the virus migrates up along the nerve until it gets to the brain and the salivary glands. So, and this can take up to a year sometimes. If an animal was bitten on its paw, the rabies virus is going to take a long time to travel from that paw all the way up to the brain and the salivary glands. If that animal got bit on the nose, that's a much shorter distance for the virus to travel, and it could just be a few weeks before that animal developed rabies. So if your animal is occasionally accidentally scratching you, and that's something that your pet has always done, that would be a very, very rare way of getting rabies, and it would not be and it would not indicate that your cat has rabies because it's something your cat just kind of does sometimes. What will happen is that once that virus gets up to the brain and the salivary glands, that is when an animal can infect another animal with rabies. So they have had the virus for who knows how long, up to a year, as it moved up through the nervous system and finally got to the brain and into the salivary glands. Now, this is when the animal can bite and give something else rabies. And typically that has to be from an actual bite that would break the skin and get into your tissues below your skin. Once this happens, now the cat is going to start showing signs of rabies, and it will typically be dead within a week. Once a pet develops signs of rabies, that is it. There is nothing that can be done to treat that animal. The signs of rabies can be kind of non-specific. One of the most common first things you'll see is that they will have a big change in behavior. A cat that is normally a lovey-dovey cat and wants to always sit in your lap may suddenly want to always hide, or may suddenly become very aggressive. They can also get to where they are very dull and listless and just kind of sit there and really don't do anything unless something happens right in front of them. This will eventually, over the course of about a week, less than a week, will progress to a point where the cat starts to have seizures, starts to drool and foam at the mouth because they're not able to swallow, because their muscles are not working very well, and then they will eventually go into a coma and die. So if your cat has been scratching you and it has been longer than a week and your cat is doing just fine, you're in good shape. The key here is to always have your cat vaccinated for rabies, and then if you have any bizarre, odd behavioral changes, that's something you're going to want to contact your veterinarian about, to see if this is something that is a medical issue or if it could be something more serious. Animals that are outdoor animals are at higher risk of contracting rabies because they are where the other biting rabid animals are. The key here is to have your pet always vaccinated, and that cat should be in good shape. I hope that addressed that question. The key here is that an animal that has rabies is only infective for a very short period of time before it dies of rabies, and during that time, you can usually tell that the animal is not acting like itself. If you do suspect you have been bitten by or exposed to a rabid animal, you want to contact your doctor right away to talk about what you need to do next. All right. Naomi writes in to say, how can I help my dog recover after dental surgery? My dog is having several teeth removed and I want to make sure she's comfortable afterward. What should I expect during recovery and what are the best ways to help her heal at home? All right, this is a great question. So, dental care is very, very important for our pets. Depending on what survey you look at, dental disease is the number one or number two problem with an animal that we see. So, getting your pet's teeth taken care of and getting teeth that are not healthy removed will go a great way toward helping your pet feel better, making them act like they're years younger again because they don't have a sore mouth, and it also helps prevent a lot of bacterial spread from their mouth to the other organs of their body. So this is all a very good thing that you're doing. So that being said, they're going to have several teeth removed. Your veterinarian is likely to send home some kind of pain medication for you to give them during their recovery period. And you want to make sure that you do that and give that to them. The other things that we're going to want to do is they may recommend that your pet be fed only a soft diet, or sometimes they recommend just a diet of regular kibbles that your dog might eat and swallow without chewing them very much. So it kind of depends on exactly what they do and how they stitch things up after they remove the teeth. So you'll want to do whatever they recommend there. Otherwise, you want to if you've got little ones or other pets, you want to have them kind of away from the pet where they're not going to try to roughhouse with their mouths or be petting and messing with the pet's mouth after this, because it's going to be sore, and that they certainly may be more inclined to bite because of that. So we want to not do that. Otherwise, you want to let your pet just rest and do its regular thing. Your veterinarian will give you a good a timeline on what to expect and how quickly your pet should be feeling better. But really, it's just like with us. If we had some kind of a procedure, we would want to take our pain medication and we would want to just sit around and rest and not do much of anything. So you definitely during this time want to take away any sort of chew toys or anything like that that they would work on, because we don't want to do anything to disrupt the stitches in the mouth from the extractions. Those stitches can sometimes be torn open pretty easily if a pet starts to work on a nylon bone or something like that. So we want to make sure that we don't have access to those things as well. Depending on on exactly what your veterinarian did, they may recommend a cone or an e-collar so that your pet can't scratch or paw at its mouth while it's healing as well. So, but bottom line is follow whatever dietary recommendations your veterinarian makes. Have your pet take it easy and feed them whatever your veterinarian recommended they be fed after that procedure. And once they heal up, your pet is going to feel wonderful, and you're going to tell the difference. So that is very good. That is very good. Okay, Simon writes in to say, is it safe to give my cat trazodone the night before her spay surgery? My cat is scheduled to be spayed tomorrow morning, but she is currently in heat and very restless. Is trazodone safe to give about 12 hours before surgery, or could it affect anesthesia or the surgery plan? Okay, so to cut right to the chase, trazodone is a very safe drug and it should not have any impact on the anesthesia or the surgery. So you don't need to worry about that. Now, you do want to make sure, though, that you have that the trazodone is being prescribed by your veterinarian. You don't want to just you have some laying around from another pet. You don't want to just start giving your pet trazodone until you've talked with your veterinarian and make sure there's no other underlying issues that could create a problem with that. Trazodone is actually an antidepressant. It is a SSRI, and the way that it works is then by creating kind of a mental calming effect. So, giving that to your cat because she's very restless will probably help somewhat with them being in heat. Sometimes it doesn't. Hormones are a hard thing to overcome sometimes in dogs and cats. But as far as giving your pet the trazodone, it is safe to do. If your veterinarian says it's safe to do, that is fine, and it should not affect the anesthesia or the surgery plan at all. I frequently see dogs that have to have trazodone in order to come into the clinic for their procedure because they are just so high strung, and it makes a big difference for them. And the less stressful the whole procedure is for them and for us, and the calmer the animal is, the better everything goes. The anesthesia is more smooth, and the surgery will go just fine. Amanda writes in to say, is it normal for my puppy's potty habits to change after being spayed? My puppy was recently spayed and is still eating, drinking, and peeing outside, but she hasn't pooped outside since coming home. She has been having accidents in her crate instead, which is unusual for her. Is this normal after surgery? How long can it take for bowel movements to go back to normal? And could the cone be affecting her? Okay, those are all great questions. And, we love when we've got a housebroken pet, and we don't love when they have accidents, and that doesn't mean it's their fault or anything. It's just happening. So you don't want to get mad at them, but we do want to know if there's a reason or if there's a problem. So the first thing that I always say is that after surgery, it is totally normal for a pet not to have a bowel movement at all for 5 days afterwards. So if it has been some time, that is perfectly normal for them to not have a bowel movement. And the reason for that is that anesthesia can affect their GI tract and the rate that things move through it. So sometimes it just takes a little while for them to get over that. Now, the other thing is that if they're having accidents in the crate, remember that we just got spayed, and that means that we take out the ovaries and the uterus, and some of that procedure involves working right around the colon and right around the urinary bladder, and that can sometimes cause a little bit of irritation there. And as a result, they can have some accidents. They can, because they know something doesn't feel right there, something feels kind of uncomfortable. They can sometimes they will strain a little bit to urinate or poop, again for the same reason. Something just doesn't feel quite right there. So this can all be normal in the post-operative period, and I would expect that it should all resolve and get back to its normal state within 5 to 7 days after surgery. Some dogs don't have a problem with it at all, but some dogs do. Um, the cone may be affecting her just because it kind of, as depending on the size of the dog and the size of your cone, if they're having trouble walking with it, they may have trouble posturing to urinate or to defecate with that. So it would be okay if you are with your pet and they are on a leash outside to do their business. It would be okay to take off that cone while they were out there doing that. Then you would want to make sure you put the cone back on them, because I tell you, the one time you turn your back and forget about it, and that's when they are going to go to work on those stitches and that incision. But I would expect things to totally resolve within 5 to 7 days. All right, a question has come in here, and let's see. I took in a pit breed that was living across the street for 2 weeks. He is extremely gentle, but I am afraid how he will act around other dogs when I schedule him for his neuter appointment. Can I muzzle him in case? So the answer is yes, you could. You can certainly have a muzzle with you when you take him in. Um, every place that works with dogs will have a supply of muzzles as well that they can use if needed. Now, the dog may be perfectly fine, but who knows, right? We've only known this dog for 2 weeks, and a dog that acts perfectly fine at home, as soon as we get around the sights and the smells and the noises of a clinic, everything can go out the window. So that is okay. That's nothing unexpected. So yes, you could muzzle him. I would not put the muzzle on until you got there, because they're not going to like that. They're going to paw at it and then probably get it off, and then they're going to know when you're trying to put it on the next time, and they're going to try to wrestle you to not have that happen. So I would have it with you. I would see if you need it when you get there. If so, great. If not, that's great too. But otherwise, the staff there will have muzzles as well. This does not apply to your dog in this particular case, but I will say that there are some folks that know that their pet is going to be aggressive around other people and other dogs, and there is another type of a muzzle called a cage muzzle that sort of forms a basically kind of like a little cage or a box around their nose. They're usually made of wire, so the pet can breathe and open its mouth, but if it tried to bite, it wouldn't be able to because it's blocked. You can kind of think of it like a football player's helmet and the guard around it. So that would not be the case here for your dog, but those things are also available, and they can go a long way toward helping with dogs that are aggressive to begin with. that is a great question. Let's see, he's about a year old, you say, and that is you're doing a great job with him. So thank you for sending that question in, and good luck with all of that. And I'm sure that it will all go just fine. All right, good. Let's see. Did I have another question that came in here? Okay, that looks like it is it for now. Okay, so then I had someone else send in a question. Corey. Corey sends in a question that says, my cat keeps scratching his ears. My 2 year old cat Milo, I have a cat named Milo too. My 2 year old cat Milo has been scratching his ears a lot and shaking his head. I noticed some dark buildup in one ear, but he's still eating and acting mostly normal. Could this be ear mites or an ear infection? And when should I bring him to the vet? Okay, so you've got a cat that is shaking and scratching his ears, and you can tell something is going on with him. So that means it's time to take him into the vet. What you are describing would be very typical of ear mites because they will work on their head and shake their head because they've got little mites, like little bugs crawling around inside their ear, and I mean, just imagine that would drive you crazy too. So, and a side effect of that is that they develop this really dark, waxy buildup in their ear, a lot of black debris in their ear. Could be an ear infection, but ear mites would be a much more common presentation with this. So you want to go to the vet. The great news is that ear mites are so much easier to treat now than they were years ago. So what they'll probably do is place your cat on some sort of a flea and tick preventative. The majority of those also kill ear mites, and within 24 hours, you're going to see a tremendous difference. So, and then you also have a cat that is protected from fleas and ticks as well. So definitely see your veterinarian. Make sure that it's ear mites and not something else, because other things can happen. But playing the odds, that's what's going on here, and we can get that treated right away. Wonderful. Okay, those were all very good questions. Spay Neuter Network has a few events coming up, so remember to always check our website, spayneuternet.org, or you can come here to our Facebook page and see all of the things that are going on at Spay Neuter Network and ways that we can benefit you and benefit your pet. We have several upcoming free and low cost vaccine clinics. You can get the details there. But the one we have coming up most recently is this Saturday, June 6th. We have a low cost vaccine clinic that will be at Garland Animal Shelter and Adoption Center in Garland, Texas. And that will start at 9 a.m. So if your pet is due for vaccines, that is going to be a great time to head out there and get all of that done. As always, any other time that your pet needs their vaccines, their heartworm tests, their preventative, their flea control, you can come by our spay neuter network locations, and we'll be more than happy to get your pet taken care of there as well. I would like to once again say thank you to everyone who donated to North Texas Gives to Animals. Thank you so much for your support. And remember that it is Adopt a Cat Month, and cats are fantastic pets. They can be a lot lower maintenance than dogs. They're smaller than a lot of dogs. They You don't have to take them out for a walk because they'll use a litter box. They're a great pet if you are in a small home or an apartment or something like that. They don't take up a lot of space. So if you get a cat. Oh, speaking of cats, here I've got one more question here that I will quickly do. Susan has written in to say that what is the recommended vaccine and neuter timeline for a 6-week-old kitten? I recently adopted a 6-week-old kitten named Helios after his mother passed away. I already have 2 adult cats at home, and I want to make sure everyone stays healthy. When should he start vaccines? How often will he need boosters? And what is the right age to neuter him? Fantastic question. So, you're bringing a new cat into your home, so you want to make sure that the cats you already have are up to date on their vaccines. As we are concerned about transmission both ways, from the adult cats to the kitten, and then from the kitten to the adult cats. So we want to make sure that they are up to date on their vaccines. Your little kitten, 6 weeks is a perfect time to start their vaccine series. And we are going to give them booster vaccines every 3 to 4 weeks until they are 16 months old, 4 months old. I'm sorry, 16 weeks old, 4 months old. And that way they will have a competent immune system. Their immune system will react appropriately to the vaccine and will get them up and running for a good start at being exposed to any other diseases. When they are 3 months of age, that's when they'll get their rabies vaccine. But there are the other kitten vaccines they need to start now and carry on with those until they're 4 months old. Let's see. You will also, he's 6 weeks old at Spay Neuter Network. We will spay a cat or neuter a cat as young as 8 weeks, 2 months old, and 2 pounds. So as long as they are 2 months old and 2 pounds, that's when we will do it here. And you can absolutely combine that appointment with them getting their vaccines as well. So you, good luck with that little one, Susan. You have a new cat during Adopt a Cat Month. And you are absolutely right that getting them started on their vaccines, getting the little guy neutered, and getting him started on flea and tick control is the right way to start with him. Thank you, everybody, for joining me today. It was a pleasure talking with all of you. Have a fantastic rest of June, and we will see all of you next time. Thank you for joining me on Ask the Vet Live.